Welcome to today's video where we're going to take you through some of the causes of front of hip pain when you're running. So pain might be really the front here. Now we know how important it is for you to keep running and that's really what we would like to keep you doing. We'll go through a number of questions that you can ask yourself and also a suggestion of something to try which can be your first steps back to pain-free running. And at the end of the video then we'll give you some details as to where you can go if you feel you need a little bit more help. My name's Claire, I'm a physiotherapist from PhysioFit Health and I'm here to try and help you move without any pain or issue, or at least help you figure out what the next steps are that you need to take. To get more from our expertise, please feel free to subscribe to our YouTube channel. It's important to understand from the outset that pain is actually fairly complex and it's a little bit too simplistic to be thinking that one thing might be causing and triggering the pain. In my experience, you've got pain, there's always a number of different things that come into causing it. And in order to help you, it's really trying to unpick that and just figure out which triggers are the main ones that can be causing you that pain. So it's important to state here, this video is not designed as medical advice. If you've got any issues around the hip, you've got the potential for it to be fractures, some stress fractures, other causes that perhaps aren't muscular in origin, in which case you want to get it checked out sooner rather than later. And that's what your healthcare professional or physio is there to help you with. It's really to figure out what's causing it and which direction you need to go to. And that's really best done as a one-to-one rather than getting general advice. Some of the causes of hip pain, there is a whole massive long list. One of them could be really as simple as the fact that your hip just isn't moving as it should do. So you haven't got a full range of movement that it can move in all of the different directions. Generally with the hip will lose rotation first before it starts losing any other types of movement, and that reduced rotation can actually cause a little bit of pinching at the front of the hip. You can also get muscles that overwork at the front of the hip, muscles and tendons. So that can be one of the causes. But generally, as I was saying earlier, pain isn't just one single cause. So yes, these muscles at the front might be overworking, but you have to ask the question, is that because the muscles around the back of the hip, so the glutes, maybe they're not doing as much as they possibly could do. And so you get these front muscles that are doing more work than you need to just to kind of get you running and kind of pushing you off and bringing that knee forwards. You can of course get referred pain, and so then you're kind of looking above and below the joint. So you've got your the low back, that might be giving you some pain down and around the hip area. You've got groin pain that can be mistaken for hip. You've got knee pain that you can actually be feeling more on the hip than at the knee. So yeah, you kind of have to look above and below the joint. You've got the fractures that I mentioned earlier, so you have your stress fractures that might be causing some of that pain. And you can also have the altered mechanics. Now, we've spoken about altered mechanics in that you can be overworking at these front muscles as you're driving the knee forwards and being a little bit weaker at the glutes at the back. However, so that's more of a muscular imbalance. Whereas the issue could be within the joint itself. So it's a ball and socket joint, and just depending on a number of different things, medical history and activities that you may have been doing when you were younger, it can change the joint itself, in which case no end of stretching and strengthening, it's not going to change the joint itself, and in some cases you do actually need surgery to help resolve it. So there's a number of different questions that I would be asking you if we saw you one-to-one, and also that you can ask yourself. Now, I'll just go into a few of the kind of nitty-gritty detail that I'd be asking you if you did come to me with front of hip pain. And so I'd be getting you to try and figure out where you're getting that pain within that running cycle. So do you get that pain more when you are pushing off when you're running on that one side? So is it on the push off? Or do you find you get that hip pain through that range as you're going for that knee drive? Do you find it more at the end range where that knee is kind of as high as you can get it? Do you feel like you're kind of getting it around there? Or do you feel it more when you're getting that weight onto the leg to then push yourself forwards? So yeah, just a few questions just to really kind of identify really through that kind of that running cycle, that leg cycle, where you're getting that pain. And then important questions to ask yourself when you do start to notice your pain at the front of the hip. Have you been going from doing no running to all of a sudden running multiple times a week? So just kind of think back to what you've been doing and the training you've been doing, and it's really just, have you not been doing so much to all of a sudden like ramping it up? And the other question is, if you have been running and you've been fine, have you then started to change your training that you've been doing? So have you suddenly increased the activity intensity? So are you doing more kind of hill sprints or are you doing more interval training? So kind of you get a little bit of that faster, the higher intensity activities. So then you can start putting that all together. And so if you do feel that you really haven't been doing that much running and then all of a sudden you've ramped it up, or you've all of a sudden just gone into doing a lot more of the high intensity intervals and hill sprints, you might start to be thinking that you just haven't given your body enough time to adjust to the intensity of the activity, and that's when you can get the tendons can be quite irritated, and I'll tell you that by being painful. So if you've caught this early enough, it can be as simple as just easing back on those higher intensity runs that you're doing, and just giving your body just a little bit more time to slowly adjust to the schedule that you're wanting to actually achieve. Now, you have got the 10% rule that's quite good just to keep in the back of your mind, and that works by you figuring out roughly your total distance that you'll be running during each week, and then you want to increase each week by about 10%. There's not that much evidence to really back up the 10% rule, but certainly in practice, I'll see the training errors that people are doing, and it can take 3 to 4 weeks to really get the body to tell you that there's been an issue. So you might ramp up everything, feel that you're okay, and then you can start with the aches, pains, and niggles. And so yeah, it's just giving the body a little bit more time just to adjust. If you've left this front of hip pain for a while, it can be a little bit more complex and involved just to try and get everything to settle down. Doesn't mean that it won't settle down, but it might not be as simple as just easing off the intensity of the runs. So yeah, leaving things generally, it takes a little bit longer to start to see a difference. So getting it sorted sooner rather than later is always good. So certainly in my professional opinion, keeping the flexibility of the low back and the legs can really significantly reduce the risks of getting any aches and pains. If you've got that range of movement, the muscles kind of work a little bit better. It's a little bit easier for you to kind of recruit them, and so you don't necessarily get them overworking as much as you may do if there's a joint that's a little bit on the stiff side. Leg flexibility is good. If you do want to work on a challenge, we have an 8-week deep squat challenge that you can sign up to. Challenge starts when you sign up. And you get an email each week, and it goes through the different joints. So you'll look at your low back. The hips will cover the knee and then the ankles. So we'll go through different exercises that really target the different areas. And you'll identify which areas are the ones that you would need to focus on. So at the end of it, you come out with a whole range of different exercises that you can create into a workout, and that gets you that leg flexibility, which I think is really important. So yeah, details in the description below. The easiest solution, if you are confused, is to book an online physio consultation. So we'll go through your medical history and go through really what you've been doing up till now, and what's going on with the aches and pains. And in doing that, we can help you identify really what's kind of causing all of the issues. And in identifying what's causing it, it kind of helps you with that solution. And so you can get your next steps as to what you need to do just to really help in your recovery. If you go onto our website, you've got the book online button that you can press, and then you'll be able to schedule it fairly easily. I know how important it is for you to keep going out and doing your running, and so all we want to do is help you in that and keep you moving as much as we can do. All right, see you soon.